Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the June 10th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County added no new COVID-19 cases since yesterday, so as of June 10th, Dubuque County has 372 positive COVID-19 cases. That's a rate of 384 per 100,000 population. No additional deaths were reported, so a total of 21 deaths in Dubuque County remains. 6,460 people have been tested in Dubuque County, and about 6% of the cases tested have been positive. 6 individuals are currently hospitalized, and 213 people, or about 57% of Dubuque County positive cases, have recovered to date, which is also the same as yesterday. 1,122 Dubuque County residents have had serology or antibody testing, and 63 of those, or 6%, have tested positive for COVID-19 antibodies. The state positive serology rate is about 8%. The state added 327 cases since my report yesterday. As of June 10, 2020, Iowa has a total of 22,551 positive cases. In all, about 1 in 16 Iowans, or just over 200,000 people, have been tested. About 11% of Iowans tested have been positive. 7 additional deaths were reported in the state since my last report, for a total of 630 Iowans. The age group with the highest incident of deaths continues to be those greater than 80 years old, who have experienced 47% of all Iowa deaths. Currently, 245 cases are hospitalized, and finally, 13,628, or 60% of Iowans, have recovered. Today, Governor Reynolds removed some restrictions on businesses. Specifically, starting this Friday, June 10th, the 50% capacity rule has been lifted for businesses, including restaurants, bars, salons, reception spaces, fitness centers, casinos, theaters, malls, and all the other retail places that had this restriction, and also allows senior centers and pools to reopen. All of these venues must continue to follow the Iowa Department of Public Health guidance, which includes the physical distancing of 6 feet between customers and participants requirement, providing additional personal hygiene and sanitation measures for the facility, along with other recommended public health measures for the various types of facilities. Now, just because these attendance limitations have been lifted, individuals, especially vulnerable Iowans and people older than 65, have to continue to evaluate their personal situations before venturing out or engaging in unrestricted activities. Keep in mind, if you are in a high-risk group for serious COVID-19 illness, such as being elderly, have an underlying health condition or chronic disease, you don't have to participate or go to public places, particularly indoor spaces, with public attendance or in other types of gatherings. Also, we all have to continue to stay home if we're sick with any ill symptoms, but especially COVID-19 symptoms, including fever, cough, difficulty breathing, sore throat, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. In other words, if you're sick with anything, stay home. Likewise, we all should be conscientious about limiting our in-person interactions with vulnerable Iowans that have underlying health conditions and/or who are older. Looking at a more global note, on Monday, June 8th, a World Health Organization official made a comment regarding asymptomatic transmission of COVID-19 virus being very rare. This statement was not meant to be a policy adjustment or recommend new or different public health measures or mitigation strategies. It was based on 2 or 3 published studies that followed asymptomatic cases. As we take a deeper dive into this statement, it reminds us that yes, transmission has been documented to occur from a COVID-infected person before they have symptoms, and this is occurring. Throughout this pandemic, we've learned that some infected individuals develop symptoms, some develop mild or only a few of the known symptoms, while others become severely ill and even die. So there is a spectrum of what people experience, just like many illnesses. Over time, COVID-19 symptoms have been added as we've studied and learned about the virus. Back in March, the only symptoms described were fever, cough, and difficulty breathing. Since then, symptoms of fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea have all been added as possible COVID-19 symptoms. We also know that after an asymptomatic person tests positive, they may go on to develop symptoms several days later. So they are no longer asymptomatic. Think pre-symptomatic. Another complicating finding is that some people do have symptoms, but they are so mild they don't realize they're occurring. We know this to be true in other infectious diseases also. So a lot comes down to the definition of symptomatic or asymptomatic, which can mean or man itself differently for people. So how much asymptomatic transmission is occurring? We simply don't know. Research is ongoing, and the data collected through contact tracing of positive cases will definitely provide more evidence for how the virus is transmitted. So for the time being, we have to protect ourselves in a way that acknowledges asymptomatic transmission can occur, especially since we can't always notice or detect symptoms in people we come in contact with, those we encounter in public spaces particularly, who we most likely don't know. Thanks for tuning in today. In the meantime, let's all continue to be safe and practice proper health measures. Remember to seek accurate and evidence-based information. Be smart. When in doubt, don't go out. And remember, we're all in this together.